Stacy Vason. Here's Stacy at dermatologist Dr. Kaplan's office.
Men, I have received your emails and your inbox messages. Today, we're talking about men on Let's Talk Beauty. I am Stacy Vason, and we are on location at the dermatology office of Dr. Robert Kaplan. Thank you for joining us, Dr. Kaplan.
Thank you for having me.
As I mentioned, I get emails from men inquiring about what can they do about their hair thinning, particularly in the crown area.
Well, unfortunately, that is 80% hereditary, and it's not much we can do about our genes yet.
Right, exactly.
But that's why men often get it on the crown and the frontal areas of their scalp, and it's largely hormonal, and it starts as early as the teenage years, and certainly after 40 or 50 can progress, but it can start early in life.
Dr. Kaplan, are there any treatments for men who are thinning, particularly in the crown area?
Well, we have one drug on the market called Propecia, and that decreases dihydrotestosterone, which causes hair loss. And the problem with Propecia is it has some side effects that some people, erectile dysfunction and loss of libido, possible depression. These are rare side effects, but some people choose not to use the drug because of these problems. But it does work reasonably well in keeping the hair that you have and growing some new hair. There's always, of course, hair transplants, which some people have done, and there's going to be some gene therapy down the road that really looks very promising.
There is a new treatment that we discussed earlier, plasma.
Yep, platelet-enriched plasma.
Yes.
And it is used to treat, what you do is you take your own plasma and you activate the platelets, and it is felt to have some healing properties. It's used mainly for joints, tendons, ligaments, but some people say it actually grows hair and it's actually being used. But the jury is really out. It's way too early, and there are not enough studies to prove its effectiveness.
Because it's still fairly new.
Yeah,
okay.
Very new, not really approved in a widespread way.
What are some of the hair and scalp issues that you see in your office on a daily basis that men face?
Well, they have psoriasis. Women have it too. Seborrheic dermatitis. This is itchy, scaling scalp, and also this can cause some hair loss also. Lichen planus is a similar type of disease. Lupus can affect the scalp, and all these can cause hair losses.
So what are the early signs that they would see with their hair and scalp when they would need to come and see a dermatologist?
Well, psoriasis, for example, is scaling and itchiness of the scalp, a lot of flaking, and get a lot of dandruff, excessive dandruff. And these issues can be treated very effectively, though.
Why is it not just for men that hair loss occurs in the crown area opposed to above the ears and in the nape area?
Good question. The dihydrotestosterone is the hormone that we all have, and it causes hair loss when in excessive levels. However, the scalp hair around the edges and the back of the scalp is not as susceptible to dihydrotestosterone, and that's why it tends to be there longer.
And folliculitis of the scalp.
An infection of the hair follicles, and that can cause hair loss, and black men often get a condition called pseudo folliculitis barbae, where you get these, it's called razor bumps, but you get lesions and pustules in the beard area, in the back of the neck, and in the scalp, and this also causes hair loss.
So how is that treated?
That's treated, sometimes antibiotics by mouth are necessary. Retinoids such as Retin A or topical antibiotics are all very effective.
If men lose hair from that scalp disorder, will the treatment allow their hair to come back?
If there's not too much scarring, if you treat it early and effectively, you could reverse a lot of that.
Dr. Kaplan, it has been a pleasure, as always, to have you. And thank you for joining us on Let's Talk Beauty. Be sure to visit me at stacyvason.com, as well as follow me on Twitter, Instagram, and Facebook. See you next Monday for Let's Talk Beauty.
Coming up, he's a